program will be moderated by me, so please send in your questions, all of you, both our live audience and those that are out there in our on-screen audience. And so without further ado, please welcome Dr. Jennifer Swales.
Hi guys, thank you so much for coming out tonight. I really appreciate it. This is a topic that is so near and dear to my heart. I actually didn't even realize it was Women's Health Month when they first asked me, and then when I found out it was Women's Health Month, it sort of made me even more excited. I actually got interested in women's health before I even went into medical school. When I was in college, I had the opportunity to go work at hospitals in Peru and Kenya. And while I was there, they let me do something that undergraduate students really should never be allowed to do, which is deliver babies. And so I got to deliver a lot of babies, and it was just an amazing experience. I got to, hold them and put the little ointment in their eyes and give them back to their mothers, and it was just, I don't know, so inspiring. So I went to medical school. Sure, I wanted to be an OBGYN, like our amazing colleagues back there. I ended up realizing that I just didn't want to let go, though. I wanted to take care of them when they were young and take care of them in their middle ages, and then as they grew older and maybe their gynecologic issues faded in the background compared to other things. And so that's why I ended up as a general internist. I was thinking about this talk, and I realized that those babies that I delivered are now in their 20s, which is crazy. And so the way I decided to structure the talk is that we can sort of talk about the life of a woman in 3 different stages. So there's when you're young and you're in your reproductive years and you're having children and things like that. There's middle age, and then as you become more mature and enter the later years, I think that that's important to talk about as well. I think I'm happy to talk about whatever y'all are interested in, so please send in your questions. But instead of focusing on all the things that can happen wrong with our bodies, I thought it might be better to talk about all the things we can do to stay healthy. I think that we know when we're not doing well to go to a doctor, but sometimes we don't know all the things that we can do to maintain our health when we are feeling well. So the first age we'll talk about is our childbearing women. And the nice thing about this age is they're usually very healthy, and all we're really talking about is how to prevent problems coming up. And there's really a lot that young women can do to prevent health problems in the future. One of the most important ones, as you guys probably have heard, is osteoporosis, which is a huge cause of problems in women as they get older. And we always describe it as a young woman's disease that manifests in older age. And so this is why we talk about diet and exercise, right? And diet and exercise is sort of hilarious because we see it all over, Sometimes I send a note to my patient and I'm like, your cholesterol looks great. Keep up your healthy diet and exercise routine. But I don't think people necessarily know what that means. And I think it's important with women to keep it really simple. A lot of women have a history of problems with their bodies and food issues and things like that. So the way I describe a healthy diet and exercise to my patients is that they should take a plate and cut it in half. Half of it should be fruits and vegetables. 1/4 should be a protein. There's growing data that instead of a meat-based, animal-based protein, it's really important to sort of focus on the plant-based proteins when you're looking at that 1/4 of your plate. And then 1/4 of healthy grains. And with the grains, the important thing is that it's a whole grain as opposed to a processed grain. So this is things like quinoa, whole grain bread, brown rice, all of those sorts of things that are a lot more nutritious for our bodies and give us a lot more fiber. From an exercise perspective, I think many women think that we need to be doing CrossFit and look like, I don't know, someone famous and thin, Jillian Michaels, in order to have a healthy exercise regimen. That is not true. Exercise is important no matter what size your body is, and whether your body size changes in the context of exercise doesn't matter. You just need to get your body moving to maintain function. And the magic number for most women is 150 minutes a week. So about 20 minutes a day, walking around a park with your friends, walking with your kids around a playground, whatever it is, that's what's needed to prevent hypertension, diabetes, and to give you that weight-bearing exercise that you need to prevent osteoporosis. One of the things we're always wondering as young women, I don't know. One of the things we're always wondering is, do I need a supplement, right? Calcium and vitamin D we know are important, but you guys have probably heard there's increased data that maybe calcium supplements aren't actually good for us. And I think the thing for a young woman is that their risk of osteoporosis is much higher than their risk of cardiovascular disease. So the most important thing is to get the calcium and vitamin D. If you must take a supplement, then you must take a supplement. However, I don't think most people really realize how many foods have calcium. We always think that you just have to be eating cheese and milk, which the cheese is really good for me. Like, I can eat a lot of cheese. But a lot of people can't and don't enjoy those foods. You can also look at all the leafy green vegetables. I know those aren't people's favorites either. But there's also a lot of calcium-fortified foods that you can find on the market. So I was looking at my grocery store, and there's calcium-fortified oatmeal and calcium-fortified bread and calcium-fortified, all these ways to get dietary calcium. And so I really think it's important to give that a good, solid go before you start, eating those chocolate gummies. I don't know if any of you guys, I guess they're not gummies. They're like Starbursts. They're kind of gross, I think. They always stick in my teeth. So healthy diet and exercise, avoiding those sorts of supplements. The one supplement that most women of childbearing age really need to be taking is folic acid. So you guys have probably heard folic acid is very important to prevent neural tube defects in pregnancy. And whether a woman is planning to become pregnant right away or not sure about that, it's always good to have plenty of folic acid in your body. It's important to talk to your doctor because some women actually need an elevated level of folic acid, need 4 grams instead of 1 gram. And so it's important. I think one of the themes you're going to see here is that women's health is very individualized, and folic acid is part of that. As far as other supplements, it's very controversial. I feel like I walk through the supplement section of the grocery store, and they're marketing to me, They're like, healthy hair, healthy, nails. Are you tired? All these things. And I'm like, yes, I'm tired. I have 2 little kids, I'm tired, right? The problem with supplements is that they're all regulated as food products instead of drugs. And food products have a different standard for how they are monitored in the United States. The first thing is that nobody is watching what's in the pills. And so they've looked at a single bottle, of a medication, maybe ginkgo biloba, and looked at different tablets, and they all have different amounts of the medications in them. They've also done studies where they've looked at some of these pills and found that they have actual medications in them, which is fascinating. There was one that was for prostate health. Sorry, that's a men's topic. And they actually found that it had cancer chemotherapy in the drug. So they're taking medication without monitoring. And similarly, in heavy metals, all of these things. So you have to be really careful about the source you're getting it from, and you have to be aware of when you're switching bottles that you might be getting something totally different. The other thing that's different between supplements and medications is a medication has to go through this 3-stage process where first we prove that it's safe, then we figure out what dose, the balance of side effects and benefit is the best, and then we do a huge clinical trial to prove that there's a benefit. Supplements haven't been through that process. Now, that doesn't mean that they don't have some benefit. I think we have to be humble as allopathic doctors. Some of these things have been around for much longer than our allopathic medical history, and they've never been proven to work. And so I think that you need to take them with a big grain of salt and not stick with them if they're not working. So those are the main things that I think about with my younger women when we're talking about what's going on with them in clinic. As we move into middle age, we sort of shift a little bit away from just preventing to also looking to detect early stages of diseases so that we can intervene before they become a problem. So in addition to pap smears, which should have been ongoing from the very beginning, we start talking about mammograms, colonoscopies, CT scans to look for lung cancer if you've been a smoker in the past. And this is another topic where I feel like every 6 months I will pull up the news or I get some sort of notification on my phone and it's like, oh, there's a new guideline on how often we should be doing mammograms. And it can be really confusing. So I think the way to think about this is to realize that everyone's risk is completely individual. One person, let's say I have 2 of you, you both have a family history of breast cancer. Maybe you both have 2 family members who have breast cancer, right? One of you has a mother who had triple negative breast cancer when you were 45, so there weren't hormones in it. That's a very high risk family. Other person has one family member that was diagnosed at a much later age and was probably more normal. So there's actual calculators that we can sit down with you and figure out your exact risk. And after we've done that, then it's much easier for us to figure out when you need your mammograms and how often, and to make that decision together. Now, I have some women who look at my calculator and they're like, yeah, but I hate mammograms. And I think in that case, that's their decision, right? And we can go to the most low frequency, which is probably after the age of 50, doing it every other year, like the USPSTF recommends. Or, I mean, the truth is, you guys can decide and never do a mammogram again in your life if you want to. So the other thing to think about with the individualized screening is that if you are someone who is a little older and has started the screening process, your health findings matter dramatically to the younger people in your family. So let's say you turned 50, you got a colonoscopy, you had 4 polyps, right? They were removed, no problem, no reason to tell your kids. That's not true, because those 4 polyps, if you tell me that and I'm your daughter's primary care doctor, I'm gonna screen her with colonoscopy at a younger age. So you need to be really transparent about your family history, things like colon polyps, early stage breast cancer, trying to get details of the hormone receptor status and other things to your young people, and especially to your young people's doctor, so that they can make the best decision. The other things that we're looking to detect are diabetes, hypertension, hyperlipidemia. All of those screenings really start with much more frequency at age 40 and then continue as we go on. And hopefully some of you guys have seen your doctors pull up the cardiovascular risk percentage calculator, and we can put it in, and that helps us figure out whether you need medication, at what point you can just continue with the diet and exercise that we talked about before. So then moving into the third phase, as you become more mature, the main thing that we're really going to add here is looking specifically for osteoporosis with the DEXA scans, and then recognizing that as you get older, you're more susceptible to specific infections. It's really important to stay on top of the vaccinations. Some of my patients look at me like I'm crazy when they're 65 and I'm asking about their vaccination status from a decade before. They're like, I have no idea. I got it at a random Walgreens, in Austin when I was visiting my daughter. But it's really, really important, because I need to make sure that you're getting your pneumonia vaccine, that you're getting your shingles vaccine, and that's when the yearly flu vaccine becomes much, much more important. I think it's important all the way along, but influenza in an older age group can cause a huge problem and take someone who has an enormously good functional status and drop them down quite a bit. So those were the main things I wanted to talk to you about and sort of cover the spectrum of life. I'm really excited to hear what questions you have for me.
And we have lots of questions.
Really? That's good.
2 or 3 questions have come in about midlife hair loss for women. Is it normal? One of the women had asked, is it a sign that something is wrong? Her friends are telling her that it's her thyroid. And her other friend is telling her to go to Walgreens and get Rogaine. So you need to help these friends.
Yeah, I really appreciate these helpful friends, though. I think that they need to bring up their concerns before the patient comes into my office. Much better than afterwards, because then the poor patient, is traumatized. So hair loss does happen as you grow older. There's a broad range of causes for it. Everything ranging from traction, so it's called alopecia. It's a long word for it. I'm going to probably accidentally use it. Traction alopecia, which is just from pulling your hair back and maybe going to too many blow dry bars, or braiding your hair too tightly or whatever else, and you start getting widening of the part here. There's also causes that are inflammatory, where people start getting little patches of hair loss. There are things related to scarring, where you can have a rash, and as it heals, the scar covers up the pores so you aren't able to have normal hair growth anymore. And there are things related to hormone problems, like the thyroid. And the thyroid is such an interesting hormone, right? Because it's like the conductor of the entire body, and it's very easy to blame for every single problem that comes up. And rightly so, because it can cause almost anything. However, if your thyroid testing is normal, your thyroid is probably not the cause of your hair loss. We can do some basic hormonal tests in the office to find out what it is. And if they're all normal, then it's probably just part of your aging. As your estrogen levels drop, unfortunately, your hair will begin to thin. I don't ever recommend taking your husband's Rogaine or any of your husband's medicines. Don't take anyone else's medicines in general. for so many reasons.
Absolutely. And that brings up several other questions on hormone replacement therapy. So I'm going to give you the range here. Several questions came in. At what point can I consider it? And it looks to me from the questions that these are people who are also very well aware of the study done in 2002 that scared everyone off of it. And so there's the range of the young, late 40s, early 50s questions that should I, can I go on HRT if I'm, in menopause. The other end of the range of questions are, I'm 65, I'm still having crippling hot flashes, I'm worried about my heart health, etc. If I haven't been on it all these years, may I start?
Yeah. Hot flashes are just miserable. My mom had hot flashes acutely because she had a surgical removal of her ovaries, and I will never forget that first night with her in the hospital when she just sat up and gasped, and all of a sudden we had to turn up the air conditioning. There were not enough blankets in that hospital for me to get warm. Poor thing. But it's really, really very debilitating, and I think a lot of women feel like they just have to deal with it because it's obviously part of the normal aging. However, that women's health study, when we looked at the data with more specificity and looked at those younger women, there's really not that much increased risk of cardiovascular disease in the women in their 40s to 50s, as long as we're trying to taper them back down. So I am generally, if a woman has debilitating symptoms, comfortable giving her a short course of hormone replacement therapy at that age. Once you get older and you've been off of them for a while, those are the patients that really struggled in that study. And also, at 65, your risk of cardiovascular disease and breast cancer and all that stuff is just a little higher than it was when you were 50. So I really avoid any hormone replacement therapy after the age of 60, 65, something like that. Fortunately, we have a lot of other things, though, to treat hot flashes, so that doesn't mean that you just need to deal with it. There are many classes of medication depending on what else is going on in your body. Maybe if you have hypertension, there's one class of medicines I would choose compared to if you have depression, if you have chronic pain. There are many choices. And then if you try something and it doesn't work, then we should try something else. So I definitely don't want to say no to the hormone replacement therapy and make people feel like they're silenced, because it's still an important symptom that needs to be cared for.
And piggybacking on that is the questions coming in on supplements for the latter half of your life. Everything from evening primrose oil to various other supplements. And I know, as you said, supplements aren't regulated, so
yeah.
it's somewhat dangerous. But you can't toss a coin down the aisle at Whole Foods without seeing.
Right.
For women of, a certain age, this age, that age. So if you could speak to that.
Absolutely. And you could not get the glucosamine and chondroitin out of my mother-in-law's hand. I mean, it clearly helps her, or she feels that way. And so I don't want to come across that I'm completely anti-supplement. However, I think you just have to be very careful with them, and you have to listen to your body, not assume that you're safe or that they're going to help you. They might not. And as you get older and as you are on more medicines, that's when I feel more strongly that it's important not to take them. Because let's say you're taking a supplement, I'm giving you a medication, and they interact, and you come in with a horrible rash. It's hard for me to know exactly what's going on. So as you get older, it's better to simplify your medications. Most people aren't looking for more pills at that point anyway, but I really recommend avoiding supplements.
Thank you very much. This question: it took me a long time to have my first child. Infertility runs in my family. My daughters are late-age teenagers now. What should I be doing to protect their future as mothers?
Yeah, absolutely. I think it's really important to think about it at the very beginning, even though teenagers don't really think that they need to consider it. I think regular gynecologic exams are going to pick up most of the things that are reversible causes of infertility in a young age. I think that also women being very aware of their cycles, and if there are irregularities, then getting to the doctor to have it tested, and so that way we can figure it out as early as possible.
And what age do you recommend, or does the Pediatric Association recommend young women starting to see an OB-GYN?
So you need your first pap smear at age 21. So 21 should be the latest that you start. But me as a mom, I mean, my daughter's 7, but I'm thinking I'm going to make up an excuse around 12, 13, I don't know. Just so that she can be in the room alone with someone else to talk about these issues, because I know she's not going to think I'm cool enough to talk about it with, so.
My daughter has debilitating menstrual cramps so bad that she cannot go to school. What can I do to help her?
Yeah. So it's very difficult when people are younger. I feel like their cramps are much more intense as their bodies adjust. The most effective medication is NSAIDs, so that's ibuprofen. And I think that, be willing to go up on the doses of ibuprofen. Make sure she's taking 2 pills and not just 1. Talk to her doctor about what doses you can safely give her. And then the other thing to consider are oral contraceptive pills, which will decrease the amount of bleeding and decrease the cramping over time. This is one of the reasons that I think it's good for young women to just get used to going to the gynecologist and getting asked questions about their body, because it's important, and we need to be comfortable talking about all of these things.
Great. This question comes from a new grandmother, and she is saying that her daughter had gestational diabetes. There are a lot of mothers and grandmothers asking questions for their children tonight. That her daughter had gestational diabetes on both her pregnancies, and she is concerned, even though the doctor has said, you're fine once you deliver. This new grandmother is concerned that her daughter's health is in jeopardy as she herself becomes older.
Yeah, I think it's a very good question. So the health conditions that affect our pregnancies live on in our bodies. Things like, it's exciting, things like gestational hypertension, preeclampsia, and diabetes in pregnancy can definitely recur in women as they age. And so I take that pregnancy history very seriously in my patient, and I make sure that it's part of our individualized risk assessment, and it affects how often we screen for these diseases. That being said, if she's being tested and she doesn't have diabetes, then she doesn't have diabetes, and she doesn't need to worry about it yet.
Wonderful. I hit my 60s, and for the first time in my life, I have insomnia. Either I can't get to sleep until 3 a.m. or I wake up at 3 a.m. and can't get back to sleep. I don't want to take sleeping pills. I work full time. This is affecting my mood, my work, and my marriage, needless to say.
Yes. So this is a huge problem, I would say, in both genders, from my experience. As you get older, your circadian rhythms sort of move forward. So the circadian rhythms is the way that the hormones vary in your body and the way that your hormones interact with your brain to let you know whether it's time to sleep or time to wake up. And so as you've slept longer, mechanisms are in place to help keep you asleep even though you're more rested, right? And so as these different things change, people often find themselves waking up early. Medicines can help. However, they're dangerous, and we're seeing more and more side effects, and so most of my patients really want to avoid them. I think that a lot of the lifestyle changes, though, can make a huge difference. I will tell you guys, I'm actually an insomniac, unfortunately for me, and I am crazy about my sleep hygiene. What this means is that I don't look at any lights after 1 hour before I'm going to go to bed, not even my computer, which is hard. I read outside my bed. If I lay in my bed for more than 15 minutes without going to sleep, I move to the couch, which my husband loves, but he'll be all right. Things like this can make a huge difference in sort of teaching your body to sleep. And there's actually even therapists now who do cognitive behavioral therapy for insomnia and teach you how to sort of control your thoughts and find space in there to finally rest. And so I really think lifestyle interventions are the way to deal with insomnia.
Great. If breast cancer runs rampant on both sides of my family, are my sons at risk as well?
That's a very important question. And the answer, unfortunately, is probably yes. If you have a cancer syndrome in your family, then it could affect both men and women, especially these classic ones we talk about, like the BRCA mutations. So there's 2 different BRCA mutations. They're associated with breast cancer in both men and women, ovarian cancer in women, and other sorts of cancer, so things like pancreatic cancer. And So if you are concerned that you have a family history of cancer, the thing to do is find someone, one of the people that had cancer, and get them to a genetic counselor immediately, because we can test them, see what gene problems they have, and then once we know what gene abnormality they have, we can check everyone else and see what they have, right? And if they don't carry the gene, then they're probably okay. Now, if we can't find the gene that's causing the problem in your family, that's a much more difficult question, because we have to continue to look and treat you as if you have a gene when you might not. So I would say that if you have a family history of cancer, go to a genetic counselor.
Can the freezing fat, this is more in the plastic and cosmetic area, can the freezing fat technique of cool sculpting, which is all the rage, you see commercials and billboards everywhere, get rid of the dangerous belly fat that is so bad for the heart?
That's a great question. So cool sculpting works by activating the fat cells and sort of dissolving them back into your bloodstream. It's becoming increasingly popular as people are avoiding things like liposuction that are much more invasive, and I would say it's much preferable to liposuction if you have decided that you want to go down this route. They've studied it, and it doesn't seem like the cholesterol from the belly fat gets into the bloodstream or causes any sort of high cholesterol or anything like that. That being said, the belly fat is an indicator of cardiovascular risk, not the main cause of cardiovascular risk, unfortunately. So you can make your belly look nice and flat, but if you still have a high triglyceride level, a high glucose level, all of these things, you're just, you're just painting the outside, right? You really need to fix the problem underlying it so that you can be healthy.
Great, thank you. Why is ovarian cancer so hard to diagnose in its earlier stages? My grandmother had it, and that concerns me. Is there a screening technique? Is there something? Who should I see?
Yeah. Ovarian cancer is very difficult to diagnose for many reasons. One of the reasons is that the ovaries are very deep in the pelvis, so we often don't feel symptoms from them until it's spread outside of the pelvis. There's also some data that the way an ovarian cancer forms actually requires it to move in some ways outside of the ovary and into the fluid around in the abdomen. So it's very, very difficult to diagnose it early. I think that as far as screening tests, we've looked, and there's really no good screening tests, even in the very high-risk women who have BRCA mutations. So in those women, we talk about prophylactic oophorectomies and taking out their ovaries. In a woman who just has a grandmother or family history of ovarian cancer and no known BRCA mutation, though, that's really too high risk for you, because taking out the ovaries has a lot of side effects for your bone health, your cardiovascular health. I mean, it's really going to mess up your entire hormonal system, like we discussed before. So in that context, I think what you need to do is be really aware of your body. And if you have symptoms of bloating, of feeling like you can't eat as much as you used to, any of these things, get to a doctor, and get to a doctor who knows you right away so that they can make an assessment.
Thank you. I have become the Sahara Desert. My skin was always thick and smooth. Now, as I age, it's like crepe paper. It's actually like tissue paper. I am dry in places I can't even mention. Any tiny bump causes me to bleed or have horrible bruises. What can I do?
Yeah, as we age, our skin becomes thinner, and the epidermis, so the outer layer, becomes less firmly attached to the deeper layers, and this is why you can get, your skin can get sloughed off with slighter amounts of trauma. Even in the hospital, we talk about it, if we have tape on, holding on an IV, and we pull it off too quickly in a patient, sometimes we can cause, an excoriation just from that. So it's a true problem. This woman is not crazy, and she doesn't just need to drink more water. There are many things that, depending on her exact symptoms, we would decide together what to do. If she's worried about her face and the appearance of the fine lines, the best treatment is retinoids, which are a topical treatment that can really make a big difference in skin plumpness, increasing skin renewal, all of those things. So that's very useful. If she's talking about the places you can't mention, we usually use hormones there to try to help, and it's topical hormones, not pills, to try to help the tissue to go back to where it was.
And this is a piggyback question as well. How much water should I really be drinking? I'm just not thirsty, but my grown children walk around with gallon jugs of giant bottles. But they don't have to worry about going to the bathroom 20 times a night.
It's such a good question. Drink to thirst. We used to think everyone needed to drink 8 cups of glasses of water a day. I used to talk to all my patients about it. There's no evidence that we should be doing it. They should just drink when they're thirsty, and if she's not thirsty, she should tell her young people that she's fine.
Okay. What is the story with statin drugs and the brain? Do they increase the risk of dementia, or do they stave it off? I've heard or read both reports.
Yeah. It's difficult. The mechanism of how statins could prevent, so statins are medications you usually take for high cholesterol. They prevent an enzyme basically that allows your cholesterol levels to go down. And they also seem to have a general anti-inflammatory effect throughout your body. And there are some theories that it could actually reduce some of the problems with memory loss in your brain. There was one study that showed that there was a difference. However, there have been multiple studies since then that did not see a difference. I think right now you're best using treatments that actually have data behind them to prevent memory loss as you age.
But there's no deleterious effect since the brain is basically a conglomeration of cholesterol and fat. So.
That's a great question. But remember that all that cholesterol, all the myelin, which is the wrapping around the neurons, that happens, a little later than we would think. So like in your teenage years and 20s, which probably explains some people's behavior. So most of that fat is already in place, and the statins don't make any difference.
Great. The commercials for Prevagen, they're all over the TV, and apparently this drug is over the counter, the jellyfish supplement. Is there any data behind those?
Well, so
I've met some really smart jellyfish.
Yes, it's fascinating because they make a lot of claims. And so one of the things about supplements is usually they shouldn't be able to make claims. They can say things like supports mental health and, that sort of thing, as opposed to prevents memory loss. Prevagen has a lot of stuff that says improves memory. And so I looked into it because a bunch of my patients have been asking this, and they have one study that shows a slight change in people's short-term memory. It is nothing compared to the data we have for the medicines that we have studied that actually are going to prevent people from ending up in the nursing home and keep them functional longer. I think if you want to try Prevagen and spend your money on it, that's your choice, but I will not, and I will not. Yeah, I don't recommend it.
Great. Also on memory, Alzheimer's runs in my family, particularly the women in my family. And now at my age of 60, I'm now forgetting the silliest things.
And we can monitor it over time. I have many patients who I check it every single year to make sure that they aren't having any loss. Unfortunately, we don't have a really good scan that can tell us for sure that you have Alzheimer's disease or you don't. We can do a scan to make sure that you don't have strokes or other causes of memory loss, and that's probably something we would do at one point if you were having trouble with your memory. But the best way to do it is to see your doctor regularly and monitor it.
Great. 2 more questions. One is also about statins, and this woman has a very, very high HDL and a very, very high LDL, bad cholesterol, and wonderful triglycerides. She is concerned to take the statin because all her friends have had body aches, symptoms, other problems with it. What should she do?
I'm so glad she asked that question, because statins are such an area of controversy, while still being one of the most important medications that we can give people to prevent cardiovascular disease and stroke, which is still the #1 killer in our country, and one of the few things that can take someone who's totally healthy after a stroke, they can have a much lower functional level. So I feel quite passionate about statins given the data. I feel that people who have symptoms, though, we need to look into that. It may be that you have a new underlying disease that's not related to the statin, Or it may be that you need a different statin. So I mentioned before that there are many, many medications. There are many, many statins. And so if one doesn't work for you, please call me. Don't suffer in silence, and don't quit it without calling me. Just let me know, and we can try different types and hopefully get you more comfortable.
Excellent. And this last question, I'm going to make it a two-parter. It's about travel and traveling in later years. One is about the measles vaccine. Quite simply, an older person who has grandchildren and is concerned that they might be able to give or receive. They don't remember if they had all types of the measles that are out there that people are worrying about. And then the other part of it is we travel out of the country a great deal. If I get sick, is there a problem with my just walking into any one of the drugstores overseas who sell antibiotics without a prescription?
Well, I think you probably know what my opinion will be on that.
Well, I'm just setting you up, girlfriend.
Yeah, no, it's worth repeating. The first time, I'll start with the second question. The first time that I traveled internationally and I saw a pharmacy that was selling the most dangerous medicines that we give, so things like Coumadin, which is a blood thinner, all of the opiates, which we know the repercussions of the opiate epidemic, medicines that lower your blood sugar and can have disastrous consequences. I mean, these are medicines that when the new interns come, they start in the summer, and we say, these medicines, when you are writing this prescription, you need to take a break and think twice. Make sure that the dose is right. Make sure that the patient is right. These are dangerous medicines. So be careful buying things overbroad. And furthermore, an antibiotic is not just an antibiotic. We have a whole class of microbiology in medical school that talks about which medicine will treat which bug and how to guess which bug, or not guess, how to tell which bug is causing your sinusitis or your pneumonia or whatever it is, and how to treat you appropriately. And like everything, it's an individualized decision based on where you work and whether you visited your grandma in the nursing home and all of these things. And furthermore, antibiotics have side effects. More and more, don't just pick one. I would prefer for you not to. If you're my patient, give me a call. And then the second question was measles. So older patients can be reassured that they're immune to measles. They don't need to worry about it. There was a very specific period of time, and I think it was in the 70s, I don't know, yeah, where there was a measles vaccine that was less effective than the other one. And so in that case, we're supposed to look into it and try to figure it out. Usually what it means is I just check a measles titer and see if they've got antibodies circulating, and usually they do, and then it's fine. So I think it's a good question.
Thank you, Dr. Swales.
Thank you, guys.
Really appreciate it. Dr. Swales, thank you for sharing your wisdom and expertise with us this evening. I know that we women are a unique and wonderful bunch, and so our peak health is important, hopefully to the men in our lives, our sons, our fathers, our families, our partners, our spouses. So thank you very much. We'd also like to thank so much Dr. Campbell for her diligent responses to online questions that we didn't get a chance to address in our live presentation. She will be seeing someone for carpal tunnel any day now. And to ABC 13 for giving us this marvelous platform to inform and inspire the Houston community to lead healthier lives, and allowing us to get some of the answers to the questions that we have. I'd also like to extend our gratitude to UT Physicians, our partner in health from McGovern Medical School at UT Health, who teach, train, and treat and provide the highest quality care for our entire family. And if you are interested in learning more about UT Physicians or making an appointment, simply go to utphysicians.com or visit one of our folks who are here today. Tonight was the first UT Health House Call of 2019. It is an honor always and a true pleasure to partner with such an authentically giving organization as Mercedes-Benz Dealers of Greater Houston, and specifically this evening, Mercedes-Benz of Houston Greenway. Thank you to Benny Gates, the general manager, who so graciously fed us and watered us and allowed us to keep each other as healthy as we can. Our next UT Health House call will be June 20th at 6:30 p.m. on abc13.com with the legendary Dr. Carmel Dyer, who is a geriatrician, a geriatric expert, and she will be in the house to help us all maximize our brain power. Hopefully help us remember to come on June 20th. That's the problem with Prevagen. Who can remember to take it, you know? To view tonight's program, please visit abc13.com. Thank you all. Please stick around, live audience, and thank you to all of you out there in our viewership. And we hope to see you at the next UT Health event. Good night.